One of the most common digestive problems that people deal with is indigestion. In most cases, it's caused by poor dietary decisions, but sometimes it's caused by a bacterial infection. In this video, I am going to show you what diagnostic test to ask your doctor to order to determine if your indigestion is caused by H. pylori. Hello everybody, Dr. Brian Disvonic here. Helicobacter pylori, also known as H. pylori, is a bacteria that infects the stomach and small intestine. This spiral-shaped organism has adapted to thriving in an environment that is very acidic, and that's why it is able to survive so well in your stomach. In developing countries, H. pylori infections often happen in childhood. In the United States, infections happen later in life, and by age 60, approximately 50% of people are infected. This organism has been found in stool samples, saliva samples, and dental plaque, which suggests that it is spread by oral transmission or fecal-oral transmission. So remember that the next time you decide to go out and eat at a restaurant. Not all folks who are infected have symptoms, but those who do have symptoms generally will have heartburn, excessive belching, and even stomach pain. For those who have burning stomach pain, that could be a sign of a gastric or duodenal ulcer caused by the organism. And something even worse is this organism increases your likelihood of developing stomach cancer by 3 to 6 times. If you struggle with any of the symptoms that I just mentioned and strict diet changes like the ones I mentioned in several of my other videos aren't helping, then you should consider seeing your doctor and asking for a specific test to see if you do in fact have an H. pylori infection. The best non-invasive H. pylori test to ask your doctor to order is the H. pylori urea breath test. It has a greater than 90% sensitivity and specificity for H. pylori, making it an excellent real-time diagnostic tool. It's also easy to do, and the testing method is quite brilliant. To prepare, you need to be fasting for at least 1 hour prior to doing the test, and you need to make sure that you haven't been on any antibiotics for at least 4 weeks prior to taking the test, because they could give a false negative result. Also, other antimicrobials, proton pump inhibitors such as Prilosec, Nexium, Protonix, Dexilant, and Acifex, and things that contain bismuth such as Pepto-Bismol, pink bismuth, and kaopectate should be avoided for at least 2 weeks prior to taking the test. When you go to the lab, the laboratory technician will first hand you a baseline breathing bag. They'll instruct you to hold your breath for 5 seconds and then breathe out into the bag. Next, the laboratory technician will mix up a solution which contains some flavoring and some carbon-13 isotope-laced urea and instruct you to drink the solution within 2 minutes, and then you're gonna wait 15 minutes to let it do its thing, and then you're gonna do the same thing you did with the baseline bag. You're gonna hold your breath for 5 seconds and then breathe out into the bag. If H. pylori is present, then the lab will be able to detect carbon-13 isotopes in the second bag that you breathe into. And the reason why this is because H. pylori will basically digest the urea, and it will convert it into carbon dioxide, and then you breathe that carbon dioxide out, and some of those carbon atoms are labeled. They're the carbon-13 isotopes, and the lab can see that, and they will know that there is an active H. pylori infection going on in your stomach. It usually takes the lab about 2 to 4 days to get the results, and if you have been found to have a positive H. pylori infection, then eradicating the organism will most likely resolve your indigestion. In case you're wondering, the most effective treatment for H. pylori is known as triple therapy, which is a combination of 2 different antibiotics and an acid blocker that you take for 2 weeks. Also, for those of you who don't like taking antibiotics, There are natural treatments for H. pylori out there as well. They're not as effective as the antibiotics, but in my experience, my treatment protocol is about 60% effective. In conclusion, if you are struggling with indigestion and nothing seems to be helping, then you may have an H. pylori infection, and it's in your best interest to be tested for it, considering that this organism could cause stomach ulcers and even stomach cancer. If you like this video, consider giving it a thumbs up. If you haven't already, please hit the subscribe button and click the bell so that you don't miss out on future videos. And if you would like to share your experience, please do so down in the comment section below. I thank you for watching, and we'll see you in the next one.